Karine, c'était une personne très, très généreuse qui avait une passion dans la vie, c'était la médecine.
This is Dr. Karine Dion, the young mother working tirelessly amid the ongoing pandemic. Her family says the stress and pressure of COVID-19 pushed her to take her own life. The 35-year-old leaving behind a 7-year-old son and husband. Now, they and others in the medical community have a message. This cannot continue to go on. Something has to be done to alleviate the pressure on healthcare workers and prevent the system from crumbling.
Au travail, avec la COVID.
Work had become something she was no longer passionate about because with COVID-19, treatment had become less about the human aspect.
Our health workers who work in emergency departments, intensive care units, hospitals, long-term care, and the community have been dealing with immense stress, mental stress, distress, turmoil, grief, and loss. And there's not a lot of time for people to really reflect on that loss.
Hospitals are starting to reach maximum capacity. 56 more patients added Monday, over 1,400 total, meaning more work for healthcare workers, and some say it will only get worse.
This could have been the iceberg, the tip of the iceberg for her. And she just couldn't handle it. And our system is already designed and needs work. Our healthcare system is already in a situation where it needs work. And she has to work on a system that is already broken, and we're breaking it even more.
The entire healthcare community across Canada still is in a state of shock hearing about Dr. Dion's death and the fact that one of our colleagues in the healthcare community would die by suicide due to the distress that she was facing on the front lines of this pandemic. We talk a lot about, wellness in healthcare. We talk a very good game, but we don't do a lot.
Dr. Dion took on this pandemic hopeful that she could provide good care and support. She even created a Facebook group called Bien-être et Résilience to help keep the spirits up of other healthcare workers in the eastern townships. But in September, when the second wave hit the province, she began to lose hope.
Elle s'imaginait qu'elle devrait.
She imagined she would eventually have to choose which patients would be seen and get a respirator and which patients she would have to send home. For her, this was unthinkable, and during the first days, she was overtaken by that thought and put too much pressure on herself. If you or someone you know needs help, reach out to Crisis Services Canada anywhere in the country at 1-833-456-4566. In Montreal, Samsara Rainville, City News.